In Health Watch now, a COVID outbreak in Provincetown, Massachusetts, is making headlines across the country. Last month, in the Cape Cod town, they saw 500 new infections within 2 weeks. They are linked to an influx in tourists. But here's what makes this flare-up so interesting. Nearly 3/4 of those cases were reported in fully vaccinated people. Those numbers prompted the CDC to change its mask guidance, which in turn created public confusion and criticism from some in the scientific community. So an article in the Washington Post argues that the Provincetown cluster, as it's being called, can be seen as a stress test of how well vaccines work. And we are now joined by the co-writer of that article, Hannah Knowles. Thanks for joining us, Hannah. So people may have heard about the Provincetown cluster. What do we mean when we write that the Provincetown cluster was a stress test for vaccines?
Yeah, we mean that, really this influx of tourists kind of threw everything at the vaccine that you could imagine from reopened America. You had all these crowds, partying indoors in close quarters. You had a town of about, normally 3,000 people swelling to 60,000 people at a time. And you also had some rainy weather that pushed people, who had planned on kind of spending time outdoors, inside. And so you really had this convergence of all the factors that would facilitate spread of the virus. And in the end, you did see more than 1,000 coronavirus infections, linked to the partying that happened in Provincetown. But about, last time I spoke to people, only 7 people had gone to the hospital. No one had died. And so I think people just really wanted these numbers to be considered in context, and they feel that the vaccine really actually did its job here, and things could have been certainly much worse in a community that did not vaccinate at such high levels.
Yeah, I think that's a really great point. In the article, you guys point out that Provincetown had really high vaccination rates, that people who were socializing were literally walking around with their vaccine cards so they could show them before they, got into places. It rained that day, and people were sort of packed indoors in a way that they weren't expecting to. But so it only stands to reason that if the virus is going to spread in a population of very vaccinated people, then a good percentage of the people who have the virus are going to end up being vaccinated. So like you say, the vaccine works. But then we're also kind of freaking out a little bit because though people didn't end up in the hospital, they did get sick. So is this sort of the new normal that we're going to have to kind of get used to, that when we say the vaccine works, we don't mean that you might not get a little sick or you might not test positive. And we also don't mean that guidance on how we deal with the virus might change from, month to month.
Yeah, absolutely. I think that, people are still coming to terms with the fact that, yes, you can get infected. That's still going to happen even as we have these really effective vaccines. And, I spoke to local officials who, on their daily calls about the outbreak would kind of, wonder aloud, like, man, are we just going to be, dealing with this now in the country after the holidays, after people have these big gatherings, and realizing, yes, we kind of have to accept some level of spread. And, when the virus does begin to spread after an event like that, there are measures you can take. You can have, mask mandate. And we saw the CDC, after this happened, cite the Provincetown outbreak, as one reason that people should mask up indoors in certain hotspots. And so I think people were also kind of realizing, just because we have the vaccines doesn't mean that we don't have to bring back some of these restrictions occasionally, when the virus does begin to circulate in your community.
Yeah, and what you guys talk about in the article, too, is how sort of poorly the communication was when it came to this information from official sources, but also from the media as well, that we were all sort of left with the idea that you get vaccinated so that you can drop these restrictions, so you don't have to social distance and you can get rid of your mask. But that's actually not why we're getting vaccinated. We're getting vaccinated so we don't get sick and die. But that message has not been clear, really, throughout this whole thing.
Yeah, I think you have, some people who, they see this and they get the message that, we need to kind of totally pull back from this, reopening of life that we were so looking forward to. And, some people react really negatively to that. And then on the other hand, I think you have people who, see 1,000 infections, most of them vaccinated, and then they interpret that as, oh, the vaccine actually didn't work. So, and then that just further compounds this problem that public health officials were already dealing with of people who are skeptical of the vaccine, people who don't actually, still after all these months, don't believe it's worth it for them and their families. And so I think just on multiple fronts, this is a story that really needed to be taken in context, and not everybody got the context. And some people just saw the headlines, which were, genuinely, game changing and revealed new things about the virus that did alarm public health officials.
That's so true. No one reads the articles anymore, Hannah, just the headlines. Hannah Knowles of the Washington Post, thank you so much.
Thanks for having me.